Good morning or good afternoon, depending on where you're listening from. My name is Chris Cronin. I'm happy to welcome you to the next webinar in our series. Today's topic is Breakthrough Engagement in Today's Workplace. I am the CEO of our employer business here at MOBE. For those that may not be familiar with MOBE, we are a mission-driven organization. Our mission is to guide people to better health and more happiness. We do that by taking engagement really seriously, and we get a large percentage of the population engaged in a program that focuses on lifestyle and medication. We do that through a team of dedicated guides and pharmacists that provide an individualized one-on-one experience trying to support an individual in their journey towards better health and more happiness. And we're thrilled to have you with us today. Many of you may have been expecting Denise Vance Rodriguez, our Chief Commercial Officer here at MOBE, to be welcoming you. Denise, unfortunately, is away. She had a death in the family, and she's taking care of what's important at her home, which we're all keep Denise in our thoughts, certainly. You know, I would like to welcome in a moment our host and the star of our show today, Ann Denato. Ann is the Executive Vice President of Marketing here at MOBE. Ann has spent her entire career focused on today's topic, trying to get people to engage with their health and trying to help support them live a healthy and happy life. She spent a number of years at Lifetime Fitness, a company that's focused on that exact mission. She spent a later chapter at a company called Red Brick Health, and we've been fortunate to have Ann as part of our team for almost 7 years now, for 6.5 years. So I would like to welcome Ann to the stage. A bit of housekeeping before I do that. We will take Q&A at the end of the session. There's a box at the bottom labeled Q&A. If you have questions during the session, we would encourage you to enter them into that box, and we will address as many as time allows at the end of today's webinar. So with that, I would turn the floor over to Ann, Ms. Ann Denato.
Thank you very much for that, for the support, and for being here today. Welcome everyone else to today's webinar. I'm really looking forward to discussing breakthrough engagement with you today. It's a topic that I'm super passionate about. We're going to cover 5 strategies that have become best practices here at MOBE based on our experience, and we'll talk about how you can leverage them within your organization as well. First, I will say you cannot achieve world-class outcomes without world-class program engagement. Just having great benefits or a great well-being program doesn't equal great outcomes. Engagement really needs to be, I think, a more central part of your vendor selection discussion. It is the first step in health behavior change. So making a decision to participate, making a decision to join a program is the first step in health behavior change. So it's super critical that this is something that you and your vendor are really great at. The other thing I'll add here before we go on is, what do I mean by world-class engagement? It has to be a meaningful metric, right? So I'm talking about a meaningful action, someone taking action to participate in your program, in your service in a meaningful way. It might vary a little bit by vendor or by service type, but it can't be just a surface engagement metric. So yes, I'm talking about a significant portion of your population engaging in meaningful ways. And today's themes, I'm going to hit on a couple of them. They're going to come up on repeat. So before I jump into the strategies, I'm going to highlight these things because you're going to hear me mention them a few times today. First, a tight working partnership between marketing and data science is an absolute requirement to optimize engagement today. It's really non-negotiable. This has changed so much over the past even 3 to 5 years. Success is really not just about the campaign. It's about population insights, segmentation, recognizing and being responsive to participant actions. So in other words, it's all about the data you have and the data you generate and what you do with it. The other thing I'll say here is that condition-specific campaigns limit your engagement potential. That might be a little bit of a controversial statement, but I feel pretty strongly about it. Again, based on years of experience, they're not all bad, but targeting people based on the presence of a condition or a diagnosis is really, it doesn't provide you that much insight into the individual. It doesn't tell you, for instance, if their condition is well controlled or if it's poorly controlled and they're really struggling. And sometimes what you'll see is people will build an engagement communications calendar with each month dedicated to a condition. And ultimately what this means is you're not connecting with your whole population regularly. You're connecting with small segments of your population at different times throughout the year, and this is important. I've seen wellness offerings themselves evolve quite a bit over the past 10 years to be much more holistic in their approach, to include things like emotional, social well-being, financial well-being. And I've seen the engagement communications tend to lag behind that product evolution just a little bit. So more on all of this as we move through today's discussion. I'm going to hit on the 5 areas that we're going to cover today. We're going to talk about who you're going to want to engage in your program and why, what type of content works, when is the best time to conduct outreach, where, what channels to use to connect with your population, and of course, how ultimately to know what is working. So, okay, let's dig in. First strategy, covering who to engage, is to engage your whole population, but not for the same reasons. We're going to be talking about effective population segmentation. What do I mean by engage your whole population, but not for the same reasons? I think probably anyone on this call today who's responsible for employee or member well-being program has at least 2 big objectives. One is to get an ROI on their investment in that program, or to reduce what would have been their expense in the absence of that program. And second is to generate a positive employee or member experience, to offer a program or a benefit that's recognized as valuable and one that generates high participant satisfaction. And you can achieve both objectives, but to do that, you can't just focus on those who are unwell or who have a specific disease state or diagnosis, nor can you just generate high engagement numbers by allowing people who are already healthy or already engaged in active health behaviors to engage in your program. Sometimes participating for the incentives. So this is something I've actually heard a lot about and a lot of complaints of over the years, is that they're engaging high numbers of people who are already healthy and not enough people that aren't. So this is what I mean by you have to engage the whole population, but you're doing it to meet different objectives. And so you have to know who's in one camp and who's in the other. Who are you engaging to achieve primarily your cost objective, and who are you focused on and generating high satisfaction? So this is where population segmentation comes in, and that critical partnership I talked about between data science and marketing. I'm going to talk about MOBE's population segmentation for a few minutes in this section. It is trained on both claims data and demographic data. It doesn't look for specific conditions. It looks for trends in health behaviors. And what it does then is it predicts levels of future claims spend. And this is really important. So it's these insights that inform our population segmentation, and then in turn inform engagement strategies to help you achieve those 2 objectives. I'm going to take a closer look here at the population segments. And in doing so, I'm going to brag on our data science friends for a minute, because I think they do some amazing work. And we wouldn't have the engagement numbers we have if it weren't for that tight partnership. So, and again, this is informed by a series of models that look at health behaviors, and they're predicting sort of the future 12-month spend. So the 3 groups here: first, persistent health challenges. You will see down below, this is a quarter of your population, but well over half your claims expense, 60% of your cost, which is remarkable. If you want to achieve cost savings with your program, you need to engage these individuals. In fact, from an engagement perspective, they're going to be your primary focus. The middle group here, elevated risk, 20% of your population, a quarter of your cost, a bit more proportional. They're not spending at a super elevated rate today, but they are identified as being at greater risk of having more serious issues in the future. So what you're doing here is you're engaging to prevent future spend. That elevated risk might be something like identification of a specific combination of prescriptions that indicate risk, or potentially behaviors that indicate that there might be a chronic condition present that's not well managed. And then last but not least, your low healthcare utilizers. Half your population is in this group, only 15% of the cost. So this is not where you're going to get your cost savings. But you can do 3 really important things with this large group. 1, support those healthy behaviors. 2, generate high participant satisfaction, great recognition of valuable benefits and high satisfaction. And 3, of course, monitor this population for changes in health status. We all know that health is not a static thing. And if you can't identify these segments, then you can't design segment-specific engagement strategies, and you certainly can't report on their performance. And those are going to be really valuable insights for you as you move forward. So I know that over the years, that's a question I've gotten a lot. Who is engaging? Are the people who are really, stand to benefit from this program, who really stand to benefit from some health improvement? Are they engaging in my program? And you need to be able to answer those questions, and you need to have strategies to drive metrics where you want them. So I'll admit, delivering on this strategy really well. I talked about, enabling you to apply this in your workforce, in your workplace, excuse me. It's not quick, it's not easy, but if done well, it absolutely pays off. While I was talking, I saw a question pop up in Q&A related to social determinants of health and the role that they might play in population segmentation. Great question. Thanks for asking. I will come back to that in the Q&A section, so just hang tight on that. I also see that I have a question, and this is a good one. When I talked about setting different engagement goals for the different segments of your population, what do I mean by that? What does good look like? I want to hit on that one really quick before I move on to the next strategy. As I said at first, your cost savings are going to come from that first group, and from an engagement perspective, that should be your priority. So I would say what good looks like for that first group is probably in your first year of program rollout, somewhere in the neighborhood of 30% engagement, if not more. And when you're looking over to the right, your low healthcare utilizers, you're probably looking at something more in the neighborhood of 20% or more of engagement. So obviously there's a lot of variables in any given company and any given population, but just to give you an idea of what I'm talking about from a solid engagement perspective, that's sort of a baseline, and you build from there. I'll move on to our second strategy. This is to become a welcome presence in the mailbox and the inbox. I'm going to talk here about what type of content is the most effective to drive the kind of breakthrough engagement you want. This is pretty straightforward. If your communications are not welcome in your population's life, you're invisible. If you're invisible to your population, then you're kind of dead in the water. Your engagement efforts are not going to be successful if they're not even seeing you. We all use a lot of one-to-one channels to reach our populations. We use email, direct mail, maybe phone. These are channels where it's really, really hard to break through and to be memorable. So to do this successfully, you're going to have to engage 2 campaign strategies in tandem: direct response marketing and content marketing. And the next slide has some examples. And I'll just point out some differences here. Direct response marketing on the left side, and these are some examples from a variety of campaigns that we leverage here at MOBE. They focus primarily on your product. You're talking about yourself here with a direct call to action to engage with your program or your service, possibly with an incentive to do so. Content marketing, the examples on the right, involve creating and sharing content that's inherently valuable and helpful to your audience. And it might come in the form of blogs, ebooks, infographics, videos, articles, different forms of content. And so when do you use which and for what purpose during your introductory period? I'll say that you want to establish a baseline awareness of your program, and direct marketing is the way to go here. And so you want to establish an understanding of what the offering is and make sure that you've landed that message. But after a period of time, if you don't take a pause from that type of campaign, you run a real risk of, at minimum, becoming invisible, but maybe even worse, intrusive or annoying, in which case, as I said, you're absolutely dead in the water. But if you stop sending your campaigns entirely, you're going to be completely out of sight, out of mind. And so on the right here, you have content marketing, and you see some examples of some really engaging content, in this case, covering things like healthy sleep, maybe stress, some good recipes. Those are types of content that we tend to see the highest engagement with. Quizzes, videos, recipes, they're all extremely popular. So when I think about these 2 types of campaigns, I think about people that you meet. We all know someone who likes to talk pretty much only about themselves, and they become a bore pretty quickly. So when they call you, are you super eager to pick up the phone? Are you super eager to return the call when you hear from that person or to respond to their message? You're probably not. We also know people that are inherently just fun to be around. They're interesting, they're knowledgeable, you trust them. They're who you are going to pick up the phone and call when you want advice. And that's kind of how I think of content marketing. You want your marketing to really be that second kind of person. So content marketing helps out a lot in terms of making sure that you're a welcome presence in your population's life. Doing this right is also not a quickie, but again, the investment of time in that type of content really pays off. It's a direct reflection of your program, and ultimately it sets expectations for what a participant can expect from your program. So if you have poor quality content, that is the impression you're going to leave of your program. I'll move on to strategy 3, talking about when to conduct your outreach. When is the best time? Is it a time of year? Is it a specific month? What is it? Always be present and also be responsive. So this is about being top of mind and being relevant for your population. And the only way that you're going to stay top of mind is to be present all the time, every month of the year. There isn't a right month or a wrong month. You need to always be communicating. The answer to when is always. And I am going to clarify that this isn't just about your efforts, that you're always communicating or you're always attempting to engage. This is about that you're always attempting to engage everyone, not different groups at different times. Again, that's going back to one of the themes from today, that I think condition-specific campaigns can really limit your potential. So if you're not communicating with your whole population pretty consistently, you're limiting your potential to engage. In strategy 2, we talked about creating content. What type of content enables you to be a welcome presence? And now we're talking about being consistent in your delivery of that content. And there's good reason for this. We can't predict a motivation wave of our population. It would be great if your population's motivation happened to align nicely and peak with your open enrollment period or the launch of a new program. And for some it will, and that's great, but certainly not for all. And so that leaves us with the need to absolutely remain top of mind, to be consistently communicating, because if you're not communicating, they are not thinking about your program. And I will add to this, the second half of this strategy here is to also be responsive. What do I mean by that? This again speaks to data. There's a lot of opportunities for you to be particularly timely in your communications, and doing so helps to build trust with your population. If your messages are relevant, if your messages are timely, you're going to build a relationship with your population over time, a relationship of trust that will help. So for example, if someone engages with your email campaign, if they're clicking through on an email and visiting your website and looking for more content, that's an indicator to you that it's a really good time to reach out with a follow-up message or maybe a call to that individual, because they're curious and they're exploring. So you have to sort of proactively have your communications ready to act when these opportunities present themselves. When you put all this together, if it sounds high maintenance, it can be, but a good marketing automation platform is going to really lighten your load here. It can automatically send out campaigns at a predetermined cadence to a population or segments. And it can also trigger these more individualized messages that I mentioned based on these one-off data trigger individual level data. There's a really good chance that if your company is working with a vendor, they probably already have this type of tool. That's something that you should probably ask them about, make sure that you understand. And if you are new to this area, my recommendation is don't try to do this all at once. Start small and build from there. Pick one data point, build a triggered campaign around it, and then build from there. Monitor for performance and build from there. All right, strategy 4. We are almost there. I'm going to talk about where to connect effectively with your audience using different communication channels. So strategy 4 is to deliver your messages across multiple channels, multiple times. For anyone on the webinar who's worked with a marketing agency, for a marketing agency, or used a marketing agency, this is really media planning 101. So I'm talking about reach and frequency here. Reach, of course, is talking about the percentage of a target population that you're going to reach with your campaigns, and frequency refers to the number of times that they're exposed to your message. Going way back to strategy 1, targeting your entire population, your goal should be 100% reach. This is usually doable. We already know who our target population is, and we typically have at minimum a mailing address and most frequently an email address as well, and in some cases phone numbers. So achieving 100% reach is probably not your biggest challenge, but frequency here, when you can find various reference numbers out there, I would say a good rule of thumb for frequency is that you want to be somewhere north of 10 exposures per person in your population if you want to optimize for engagement. Maybe a little lower if you're really just looking for awareness, but if you're optimizing for engagement, you're really going to have to get the frequency up there. And I'm going to touch on 6 supporting points that you see here to help you optimize how you use the channels that you have. Again, with the theme, steer mostly away from condition-specific campaigns. We've talked about this, but it's worth mentioning here again. Keep reach and frequency goals in mind as I'm saying this. Carving your population up into disease-specific campaigns, it not only sets you up to deliver messages that aren't relevant to a whole bunch of your population, but it also throws off your reach and frequency math as you're building that up throughout the course of any given year. Second, use all the channels you can, at least to start. I get this question a lot. Which channel is the best to use? The answer is you don't necessarily know for sure yet. Just because someone has an email address present doesn't necessarily mean that that's going to be the best channel to use with that individual to break through. And like I said, we're working with channels where it's difficult to break through. So start with what you have, use what you have, which leads me to the next point, that breaking through requires repetition. Be consistent, be patient, and be welcome in that inbox and mailbox. Be a welcome part of your participants' lives. You will want to vary frequency by population segment. Again, going back to strategy 1, revisit your objectives. If the segment of your population with the most present health concerns, if those are your engagement priority, you're going to want to target a higher frequency of exposure to that segment. For your low-cost population, awareness of and appreciation of your benefits is key, as well as generating a positive experience. So you can tune your campaigns to deliver a slightly lower frequency to that segment. Next up, respond to recipient actions. And there's tons of great examples here. I mentioned this with strategy 3 as well, as it relates to when to reach out, to be responsive in that way. I'm going to say it again here now as it relates to optimizing your use of communication channels. A minute ago, I said to use all the channels you can, at least to start. From there, observe how individuals are interacting with your campaign. If someone's consistently engaging with your email campaign, they are now letting you know that that is their preferred channel, and you can evolve their campaign experience in real time, dialing back on the use of, say, direct mail and dialing up on email. If they're demonstrating that that's their preferred channel, then you are going to be able to build up to the frequency you want using that channel. And last, I'm going to go back to content marketing again, and I want to reiterate that the content you send has to be relevant. It has to be quality content. If it doesn't, it's going to negate all your work to calibrate your frequency and effective use of channels. Because again, this is your first foot forward. You're letting them know what they're going to get out of engaging with your company. And if it's not valuable, they're going to perceive that that program or that benefit isn't going to be valuable. So making the investment of time and effort and funds there to create valuable content is absolutely worth it. All right. Last but not least, strategy 5, invest to involve your campaigns. I want to talk about measuring success here. It's a significant investment of both time and money to build a strong engagement system, to build a strong engagement campaign. And to make the most of that investment, you're going to need to do 3 things. You're going to need to measure, test, and evolve. Not a new idea to anybody on this call, I'm sure. But I'm going to start by saying that from my point of view, all of this is something that your vendors should probably be doing as table stakes. So for all of you decision makers, program owners on today's session, do ask your vendor about their practices in this area. And for the marketers on the call today, you should be ready to answer questions about your best practices. When I talk about measurement here, I'm talking about in 2 camps, both campaign performance and engagement results. For campaign performance, we're talking about things like email click-throughs, website visits, video views, content downloads, inbound calls, and more. There's a lot of things that you can track here that'll tell you a lot about how relevant your campaigns are to your recipients. Engagement results is obviously something you want to report on regularly at all as well. So how many people are following through the desired conversion and engaging with your program or service. It's also worth mentioning here that when I talk about engagement results, again, I'm going back to strategy 1, you should be looking at these by audience segment. So given that you have different objectives for different segments of your population, you're going to want to have visibility to how those different segments are actually performing when it comes to engagement. Once you've captured performance outcomes, you should always be testing something. As I said, it takes a lot of time and money and effort to come up with an effective campaign, but every campaign can continue to work harder. So ideally, you're going to be testing with a very intentional, methodical, and ongoing process. I'll say even your strongest performing campaigns can be improved. Any element is testable. You can test subject lines to see if you can get emails open more frequently. You can test message content or images within your campaign elements. You can test offer presentation and on and on and on. These are ways to see if you can drive more interaction or a higher percentage of conversions through your campaign. You can test various types of personalization. Like I said, there's sort of an endless number of things that can be tested here. And then evolving your campaign flows pretty naturally from measurement and testing. Not all tests that you do are going to result in performance improvements, but that's kind of the point in running the test. So when you do succeed, your campaign then needs to evolve to fully incorporate those enhancements ongoing. So you're constantly evolving and improving the performance of any of your campaigns. I will do a quick 30-second recap here of what we just covered. I packed a lot into the last 30 minutes. So before we move into Q&A, I'll quickly recap. 1, engage your whole population, but again, you have distinct objectives. You're not engaging them for the same reasons. Number 2, you want to be a welcome presence in your participants' lives. Be a welcome presence in the mailbox and inbox. Number 3, always be present, always be communicating, and always be responsive to their actions as well. 4, deliver your messages across multiple channels, multiple times. And last but not least, invest to evolve your campaigns. So with that quick recap, I think we can move on to Q&A. I see some questions still coming in. That's fine, keep them coming, but I think we'll get started here.
That's great. Thank you, Anne. You did pack a lot in, but a lot of great information, and we look forward to the discussion. As Anne mentioned, I'll take some of the questions that we see in Q&A right now. Please enter them in if there are topics that you want to talk about, learn more about. A couple of themes from there you said would be consistent throughout: the role and the harmony between marketing and data science. You talked about that in a number of places. Clearly, that's something we take really seriously here at MOBE, and then the limitation that a condition-specific approach can take on engagement. So some questions. You tipped one off on social determinants, and we got a question in, can and should social determinants of health data and information be used to guide an engagement strategy?
I think my short answer on that is yes, they can absolutely be part of an effective population segmentation. I would say ideally, there may be one input in addition to some other sources of data, but they can, in addition to being incorporated in your population segmentation, I think it is important to understand how you're engaging with individuals with various social determinants of health risk factors. At MOBE, and Chris, maybe you want to add more to this in a moment, but I'll say at MOBE, we do track individuals' social determinants of health risk factors, or SDOH risk factors. And so we want to understand proactively, how are we doing engaging with people who have a high number of risk factors? And so we look at people who have 5 or more risk factors present. And I can tell you that as compared to our baseline engagement, we're engaging those high-risk individuals at, I believe it's a 17% higher engagement rate. We're also retaining them at a higher rate, north of 25%, 28%, I think, higher retention for that population, and on and on. We see those higher results follow then in outcomes, in Net Promoter Score, in CSAT. And so I think incorporating them into your segmentation strategy is important, as is understanding your performance with those groups. Did
Great.
you want to? Yeah.
No, thank you. And I think you said it well. I wasn't surprised that this was the first question that we saw come in.
Right.
This is increasingly has become a forefront of prospective clients and existing clients' concerns and questions. And you mentioned it. We started looking at social determinants, social risk factors a couple of years ago. More broadly, we also have a health equity dashboard that we use to track some of the stats that Ann talked about, to understand who's engaging in our program, how, why, how long, and really help guide as well product development and evolution. You addressed the second question already. What does breakthrough engagement look like? Just to recap for folks, what did you say year one looks like?
My rule of thumb is for year one, for your priority group, you're probably looking in the neighborhood of 30%, if not more, meaningful engagement with your program, ranging down to sort of your lower cost group, lower utilizers. I would say you're looking at in the neighborhood of 20%, if not more. So there is a range, but you're going to want to get good, healthy engagement across your entire population.
Great. Thank you, Ann. We had the next two questions I'm going to pair together because I think they're birds of the same feather. What if you are limited to one benefits communication per month, and sometimes even just once a quarter? Actually, I'll pause there. I'll break them apart. So that's the first question. If you're limited to one benefit communication per month and sometimes even once a quarter.
And sometimes even once a quarter. I think I would say that's a tough one. And I would, the devil's in the details in terms of one communication per channel, so there's a lot of detail there that I need to peel back to really try to think about how to make most effective use of that very limited. But I would say that I would probably use that limited communication to try to get people connected with some of your other channels. So if that individual recipient then opens the door, maybe I'll connect this to the conversation about content marketing. If you're connecting them, for instance, to your website or to your blog content, and then they are able to, maybe they they open themselves up to receive more information from you, or they're coming back and getting additional content from you. So I would say if you have really limited opportunity to communicate, use it to try to create a communication channel with that person. Use it to try to establish some level of trust and understanding.
Great. Just a further, content marketing has been a big, has had a huge impact on our engagement here. Ann made the comment, being welcome in your mailbox and your inbox. You talked a lot about reach and frequency as well. This is the frequency component. We've got a story of one of our participants, Tina, on our website, who talks about, we asked her why she called MOBE, and she said, it was a 1-year anniversary of the death of her brother, and she just got something in the mail and decided enough was enough and called MOBE. So I think that's a testament to really the frequency component. So I would argue you make an argument that frequency is important, and you're going to do it in a way that's welcome in your inbox and mailbox, and really try to increase the allowable number of communications. Second question, which again is somewhat similar, looking for recommendations when a client limits exposure to the all eligible population and or communications channel, often leaving all eligible outreach to the client. So recommendation when a client limits exposure to the entire population and or the channel. And the other part of that that's suggested here, when the outreach is left to the client versus the vendor.
Well, I think I'll start with the latter.
Okay.
And what I do for a living kind of speaks to that. The second part of that really gives me pause. I'm going to say, if you're working with a vendor who doesn't consider this a core competency, where it's not really a part of their program offering, it's not something engaging people in their program or service isn't something they're good at, that's a problem. Like I said, it doesn't really matter how good the product or the service is. If you can't get people engaged with it, you're not going to get great outcomes. So I have a really strong belief that that's something that your vendor should probably be really good at. So if you are intent on working internally, if you have marketing resources to lend to that effort, You can certainly apply these strategies internally, but I can't get over the fact I really think the vendor should be offering strength in this area. And help remind me the first part of that question again, Chris.
When they limit exposure to part of the population and/or channel.
And/or channel, it's just limiting your ability to engage with. I guess I'm not sure what the individual is really getting that there in terms of limiting exposure to a portion of the population. It may be through one channel they're limiting exposure, but this may come back to when I say you're using all the channels you have. Is there another channel that's worth investing in if you are challenged in terms of having deep email penetration? You might up your investment, or your vendor might choose again to up investment in some of these other channels to begin to effectively reach that population. And you're going to have to look for other ways to creatively build up frequency of exposure. Hopefully I caught the question there.
Good. I would just add a couple of thoughts on that as well. We always take a very forthright position that we're going to partner with the client, and we're actually going to make their life easier by offloading some of those demands and really looking to leverage and again partner with the communication channels that they have already that are effective, and then augment that with things that we can do because we know these people are really busy. The other part that I didn't talk about that we're pretty adamant about, we need to be able to conduct outreach ourselves, is MOBE has a unique business model where we actually take risk on the population that we're serving. And given that business model, that puts us in a position to say, we really need to make sure we get these people into the program, which helps that conversation as well. I will take one more question if I could, which is around incentives. We didn't talk a lot about incentives. What is your strategy and belief around the effectiveness of incentives?
This is actually something, as you know, Chris, that we've spent quite a bit of time and energy testing over the years here at MOBE in terms of what incentive structure, what incentive amount, the action that's being incentive, what works hardest, and what we've landed on is an incentive, and by some standards, a relatively modest incentive to get someone over that threshold to initial participation. And I can tell you it is highly effective. You're gonna increase your engagement rate significantly by having that incentive to get started. You're gonna see probably at least 10% higher engagement, if not more. But in terms of structure, I think I had mentioned that it's a relatively modest amount. Over the years, I've seen companies offer really extensive incentives to complete a health risk assessment or to join a program, hundreds and hundreds of dollars. I don't think that's necessary. I think that what the trade-off for me would be, I think it's really important to invest in your communications for all the reasons we've talked about today. So I favor skewing a little bit more investment to your communications, to being always on, to building the programs to be responsive, to stay top of mind and be relevant. And then the incentive you offer, if well timed and on the right action, can be very, very effective.
Perfect. Thank you, Ann. Thank you, everyone, for joining this discussion. As I mentioned, this is a webinar series that we have. Look forward to the next edition coming soon. Or you see my contact information there below. If you have further questions, want to continue the discussion, want to learn more about MOBE, we would welcome the opportunity. You can reach me at chris.cronin@mobeforlife.com. And thank you for leading this discussion. This is an area that I think is underclubbed and doesn't get enough attention. There's a lot of innovation happening in this space being health and wellness. But if people aren't actually engaging with those resources, it's all for naught. And so we certainly take it seriously. Glad that you all do and took the time to spend with us today. Have a good day. Thank you.
Thank you very much. Thanks for joining.